Hello everyone, this is Dr. Fox, and let's talk about cardiac veins. In this video, we'll go over the venous flow of blood from the myocardium of the heart to the right atrium, which is to say the greater system of veins of the heart. We'll also describe the smaller system of blood return to the heart. So let us begin with the greater system. The named veins of the heart are part of this greater system, and their role is to drain the subepicardial myocardium back into the right atrium. So like all roads lead to Rome, all veins lead to the right atrium. The major conduit of blood into the right atrium is the coronary sinus, as I'll outline here. That coronary sinus is the space into which all but one of the veins of the greater system flow into. So let's start over here with an anterior view of the heart. And let us start with this vein in the anterior interventricular sulcus called the great cardiac vein. The great cardiac vein accompanies the anterior interventricular branch upward. As it rounds the bend, it goes into the coronary sulcus, coming around and draining into the coronary sinus. Likewise, on the diaphragmatic surface of the heart, the posterior interventricular branch is accompanied by a middle cardiac vein. That middle cardiac vein also drains into the coronary sinus. Coming back to the anterior view of the heart again, accompanying the right marginal artery is the small cardiac vein that runs into the coronary sulcus, wraps around, and goes into the coronary sinus. All of these veins, save the anterior cardiac veins, feed into the coronary sinus, which then feeds into the right atrium. So these anterior cardiac veins are an exception. And one of the places that we find them is draining the subepicardial myocardium of the right ventricle, and they bridge over the RCA. So if you're in the laboratory and you're dissecting out these veins, be very careful. They're very delicate, and they're very unique amongst all of the veins of the greater system in that they drain directly into the right atrium. When we think about these veins, let's always consider what they accompany. So for instance, the great cardiac vein accompanies the anterior interventricular branch, or the left anterior descending artery within that anterior interventricular sulcus. The middle cardiac vein accompanies the posterior interventricular branch, or the posterior descending artery, in the posterior interventricular sulcus. And the small cardiac vein accompanies the right marginal branch along the inferior border of the heart. Now let's discuss the smaller system. The smaller system consists of small cardiac veins, sometimes called Thebesian veins. These are named after a 17th and 18th century German anatomist, Adam Christian Thebesius, and their role is to drain the subendocardial myocardium into chambers. These typically are going to drain the subendocardial myocardium into the chamber where they are. They tend to be the most dense on the right, and especially the most dense in the right atrium. And they are the least dense on the left side of the heart, especially at the left ventricle. So even the small cardiac veins of the smaller system are returning to the right atrium, and they're in a greater density. Now, don't confuse the small cardiac veins of the smaller system with the small cardiac vein of the greater system. If you can see the vein, it's of the greater system. If you can see the vein microscopically, it's of the smaller system. Now let's assess our knowledge. Which veins of the greater system are unique for draining directly into the right atrium and not the coronary sinus? A, the anterior cardiac veins. Yep, they drain the subepicardial myocardium, bridge over the RCA, and drain directly into the right atrium. The great, middle, and small cardiac veins all drain directly into the coronary sinus. Thank you so much for your time, and I look forward to talking to you in the next video.